Okay, so let's talk about some of the benefits of stimulant medicines. First of all, stimulants work quickly. There's a quick response. Really, if somebody's taking the right dose of stimulant medicine they need, it works in 30 to 60 minutes. So it's kind of what you see is what you get. If they miss a dose, they don't get the benefit that day. But if they take it the next day, they do get the benefit that day. It's kind of like if you've got, a backache or, a broken leg or something, you take Tylenol. It starts working about an hour later, lasts about 8 hours, and it's gone. That's kind of like the stimulants. They start working, they last as long as they're supposed to, and they go away. So you don't need to build it up over time. I generally like to give each dose about a week trial. It doesn't necessarily have to be, but I like to give people a chance to have, or sometimes longer, a chance to have a good day, a bad day, a day they slept well, a day things went well, a day things didn't go so well. So we can get a sense of how it works. Generally speaking, people have 80% plus response. And on any one medicine, you may get a 60% response, though if you take somebody who doesn't do well on the methylphenidates and switch them to the amphetamines, you'll catch more responders. If they don't do well on the amphetamines and you switch them to the methylphenidate medicines, you'll catch more responders. So we get about 80% of people who do well. And as Dr. Brown mentioned earlier in the workshop, sometimes you don't get a great response and not everybody responds, and that's where it gets a little trickier. But in general, it's about an 80% response. And generally minimal side effects. Some of the benefits of stimulants, they improve the core symptoms of ADHD, things like attention, hyperactivity, and interrupting, impulsivity. It can also increase short-term memory, increase reaction time, problem solving, and also on the social and emotional aspect. In other words, there's some data, it's not a ton of data, but there's some data that the medications actually improve executive functioning as well, which is tremendously important. When we talk about dosing of the medications, generally we want to start low and build up. So the average thought, the sort of term they teach us in medical school is start low and go slow. And that generally applies. Now, there may be some circumstances where your doctor says, because of this reason or this criteria, I'd like to increase your dose more quickly. Come back in a week and we'll adjust it. Come back in 3 days, we'll adjust it. Those are usually the times where there's a big crisis. Generally speaking, if there's not a crisis, start low, go slow, gradually build up. We do not need weight-based dosing. Just for those of you, because we will get to this in Strattera, weight-based dosing is milligrams per kilogram per day. So if somebody weighs 50 kilograms and they take 50 milligrams, that's 1 milligram per kilogram per day, right? It's just a dividing thing. But for the stimulant medicines, we don't need that. But I mention it because for adult ADHD, there have been some studies that suggest that if adults with ADHD don't get higher than about 1 milligram per kilogram per day, they may not get as good a response. Now, as Dr. Brown said earlier, and I'm just going to quote him, he's right here, he's a leading researcher and expert in the field, as he said, it's not just because of the age and size. You have to titrate and fine-tune. There are some adults that I've seen who respond tremendously well at starting doses that don't work in 6-year-olds. And sometimes there are adults who need very high doses. So it's always individualized. But some studies suggest that with methylphenidate, you may need a higher dose. So let's look at a couple of dosing examples, one from the methylphenidate group and one from the amphetamine group. So Concerta comes in 18, 27, 36, and 54 milligrams. Those are the capsules. The recommended max is 72 milligrams in teens and adults. Adult, I would start them on 18 milligrams for a couple of weeks, then 36 milligrams, reevaluate, check for side effects and benefits, go up to 54 milligrams, reevaluate, and consider going higher. Sometimes a doctor could go up to 72 or even 90 milligrams. 72 is 2 36s, 90 is a 54 and an 18. That's right, isn't it? Yeah. I don't know, I write these prescriptions all the time, it's just jumping my mind right now. Adderall Xr comes in 5, 10, 15, 20, 25, 30. Recommended max is 30 milligrams. For an adult, I would start at 10 for 2 weeks, then go up to 15, and can go up to 30. Really, these dosing, I've put adults here on this slide. Really, it's the same for kids. For kids, I would start at 18 milligrams. If they're younger or smaller, for Concerta, I'd keep them on 18 for a bit longer and then go higher, depending on response and side effects. For a smaller kid, I may go 18 to 27 rather than right to 36. For Adderall Xr, if they're really little, I may start at 5 milligrams rather than 10. But really, the dosing schedule is basically the same for kids, teens, and adults. We start low and build. So I just wanted to include this from the CADRA guidelines, the Canadian ADHD Resource Alliance. There are several published guidelines based on research in the medical literature, things like the American Academy of Pediatrics, the Journal of the American Academy of Child and Adolescent Psychiatry, et cetera, et cetera. There are a number of different algorithms and treatments. This is from CADRA, the Canadian ADHD Resource Alliance. And these are very helpful guidelines. And if you look at this, these are the treatments for children with ADHD. Adderall Xr, it shows a maximum of 30 milligrams. Vyvanse, maximum of 60. Concerta, you'll see even for children, the CADRA, Canadian ADHD experts, suggest 72 milligrams a day as a maximum, even for children, which is generally 12 and under. When it comes to adolescents, Adderall Xr recommended, even though, let's just be clear on this, the published guidelines, or the approved, Health Canada approval, the on-label usage of Adderall Xr is 30 milligrams maximum. So that is on-label usage. That's what it's been approved for. That said, our Canadian ADHD experts have said that at times clinically you may need to go as high as 50 milligrams for adolescents. When this first came out, I was thrilled because I saw this as a CYA document, a cover your behind document, right? Because there were times that I would have patients who need, I'd see a linear response. They did okay on the low doses, a little better on the high doses, but not quite enough. And we'd monitor their safety with the medicine and gradually increase them. Now that it's published that we can go higher than regular dose, this is helpful for the times that it's needed. So Adderall up to 50, Vyvanse up to 80, Concerta up to 81, and Strattera just the regular recommendations. Okay, now let's just talk about Vyvanse for a moment. Vyvanse is a newer medicine. It's in the amphetamine category. It's been in the United States just under 3 years, and it's been in Canada since February 1st. This is a newer medicine that's a prodrug. And I'll have a couple of slides to explain to you what prodrugs are in a moment. I just wanted to include this here on the dosing slide because that's what we're on right now. So right now it comes in 30 and 50 milligrams. As of a couple of weeks ago, it's been approved for 20, 40, and 60. Now, if you take a prescription to your pharmacy with a prescription for 20, 40, or 60, they're going to contact the doctor like they did to me yesterday and say, this isn't available. And I say, write them back, I call them back and say, check with your supplier, it is available now. So it's really just right now that these are available. The 70 milligram tablet, or capsule that they have in the US, Health Canada wanted more data on, so we don't have the 70 in Canada right now. Basically, starting doses that, not that we've only had the 30 and 50 for so long, but those of us who have been using it, we start on 30 and go up to 50 and then evaluate. Now that we've got the 20, 40, 60, we could start at 20 for a smaller kid or a younger kid or somebody who's more sensitive to the medicines. If we look at the comparison of Vyvanse with other medicines insofar as its dosing, we've got Adderall Xr is comparable to Vyvanse 30, Adderall Xr 20 is comparable to Vyvanse 50, and 30 milligrams of Adderall is like Vyvanse 70. So that's a rough comparator. I'm just getting some experience with this medicine. It's been out in Canada just for a couple of months, and I was using it a little in advance as part of an advanced program. That said, the Americans that I speak to at the meetings, they often find that Vyvanse 30 may actually be kind of like Adderall Xr 10 to 15. And the Vyvanse 50 may be like 20 to 25. So it may be a little bit stronger than the Adderall comparator, but that's just a way to help you think about the dosing. Let's just talk about, we've spoken about some of the benefits of stimulants, we've spoken about the dosing of stimulants, some of the side effects. Lowered appetite is one of the biggest issues. And it's really while the medicine's in your system. So people take the pill in the morning, then they're not so hungry for lunch or snacks, and when the pill wears off in the evening, they get very hungry. And I always encourage people to have a breakfast, which can often be a challenge with some of the teens. I encourage them to have at least something because they may not be very hungry through the day. And if this becomes a problem for people, I've had some teens who've had a little bit of dizziness or not feeling so good later in the afternoon. And then sometimes there are parents who say, well, dinner's at 6 o'clock and you don't eat after 6:30 because dinner's done, the plates are away, everything's cleaned up. And sometimes I have to tell the parents, give them some flexibility. They didn't eat much lunch. They need to be able to, if they want a second supper in an hour and a half, that's fine. Let them have it. Just don't let them eat chips and cookies before they go to sleep, right? So lowered appetite during the day is a big issue. Insomnia is often an issue. If people take their stimulant medicine at 8 at night, they're often up till 8 in the morning, which sometimes leads to misuse in the college age and university age students who like to stay up all night. But essentially, it mostly causes insomnia. And we have to be careful. If people take their medicine at 8 in the morning and they can't sleep till midnight or 1 a.m., this is a problem. Occasionally, quite rarely, stimulants can help with sleep. There are some people who their mind races so darn much that they can't settle down for sleep. And if they have a little bit of a stimulant, they actually can. So this is one of those paradoxes. Hyperactive rebound. This is where when the medicine wears off, somebody gets tremendously irritable, emotional, or hyperactive, almost worse than if they hadn't taken a medicine in the first place. This is much less common with our newer generation long-acting medicines. It was much more common with the short-acting Ritalins and Dexedrins, though it still can happen and you have to watch for that and talk to the doctor. Sadness or irritability, some moody symptoms can happen from stimulants. Anxiety or headaches. Tics, sometimes motor or vocal tics can be brought out or worsened by the stimulant medicines, and this needs to be monitored and adjusted for. Growth slowing, 2 to 3% of people. This needs monitoring with the height and weight growth charts with the doctor over time. Heart rate and blood pressure, these medicines cause minor increases in these. If basically, and I put this in the slide deck a few times, the concern is if there's a structural heart abnormality, a hole in the heart, something that needs care with a cardiologist or cardiovascular surgeon, that's a concern and you need to get approval from the doctor to use the stimulant medicines. In those circumstances, it can be a problem. Otherwise, it's not an issue. Sometimes people, a year or two ago, there was a big brouhaha, a big thing going on in the U.S. about every child or anybody taking a stimulant medicine has to have an EKG before it happens. And really, that's not the standard of care right now. It's not needed. If there's any symptoms or reasons to consider a problem with the heart, then an EKG is a good idea. But otherwise, it's not necessary. So rare but serious side effects of stimulants, reports of stroke, heart attack, and sudden death. Again, these are people who have had structural heart abnormalities to begin with. Hallucinations and psychosis. This is really a concern if somebody's got a bipolar disorder. It may switch them into mania and cause psychotic symptoms. And it may lower seizure threshold. So if there's a concern about seizures, you need to be careful. Okay, so let's just talk a little bit about the delivery systems of the newer medicines. So this is Concerta, the Oros delivery system. What it's got is that within this sort of high-tech pill, instead of having to take a Ritalin pill 3 times a day, you take a Concerta first thing in the morning, and there's 22% of it that's immediate release that gets absorbed by the stomach right away. Then inside, there's this hard capsule that's osmotic with a little laser-drilled hole at the top. So it's osmotic, meaning water passes from the gut across the pill, and then there's this little push compartment, which is this little polymer, and the water comes in and expands that push compartment. So there are two compartments of medicine, that push the medicine out through the course of the day, and there are different concentrations of medicine based on where that pill is going to be in your stomach, small intestine, or further down. So it's a high-tech pill that lets you get your medicine through the course of the day. It's an osmotic pump. If we look at some of the bead technologies, beaded delivery systems, and this is Adderall Xr or Vyvanse in Canada. We've got immediate release beads. These are beads that are absorbed right away. And then there are some delayed release beads that essentially have the medicine inside and have this little polymer outside of it that delays the absorption of that medicine. So it becomes like you've taken a pill in the morning and a pill at lunch. And they're in a capsule. And of course, the bead technologies are the ones that can be opened and sprinkled. The newer one, Vyvanse, works in a different way. It's a prodrug. Get ready for my biggest joke of the day, okay? So it's a prodrug. We'll get to it in a second. It's a prodrug. You'll see over here, schematically, we've got this big active medicine, the orange, and it's connected to the blue inactive lysine. Lysine is a protein. So this medicine is too big to cross into the brain, so it doesn't do anything. Until there's an enzyme in your body that actually breaks that bond in half. And this is why Vyvanse is the sexiest ADHD medicine, because it has a lot of cleavage, right? So there's a cleavage of the chemical bond between the dextroamphetamine molecule and the lysine. See, I got a few laughs out of that. It was worth it. It's worth a try. So it breaks the medication. What happens is this medicine is all rapidly absorbed. So there's no delayed release mechanism. There's no osmotic pump or there's no beads. So it's all rapidly absorbed, and then it's the enzyme in the body that causes this delayed release mechanism because it takes a while for that enzyme to work. They originally developed this hoping that it would be less abusable, that essentially if people tried to snort this stuff, they wouldn't get high off it because it's not going to work. It's not going to get to the brain any quicker, right? Now, all of our long-acting medicines are much less abusable than the short-actings. The short-actings can be crushed and snorted. And as soon as you take any medication and you change the route of delivery, you could potentially increase the abusability or the pleasure that people get when they abuse it. So the long-actings like Concerta, Adderall, much less abusable. Vyvanse is virtually not abusable at all because essentially when you try to change the route and take it much more quickly, it doesn't give a high or a buzz the way the short-actings do, because it needs to be acted on by this enzyme. So that was part of it, and now what they found is it's actually sort of long-acting. When it comes to Vyvanse, one of the unique features is the odd time somebody would take a Concerta or an Adderall, and it wouldn't last as long as it was supposed to, right? And myself and other doctors would look at it and say, you know, they must be a fast metabolizer or something like that. And we didn't really know what was going on. Well, now that Vyvanse has come out with a different approach, they've looked at their approach, which is essentially absorbed right away, and then an enzyme in the body works on it differently. It works on it to activate it, compared to Concerta or Adderall. Concerta depends on the time that it passes through the stomach. So if somebody's got very quick gastric, I forget the proper medical term, but if their transit time is very quick, they may not absorb all the medication through the time they're supposed to. Adderall Xr or Vyvanse that use the Adhd technologies, they rely on stomach acid. So if somebody's taking an antacid medicine, you know, the long-acting delayed-release beads, they count on a higher pH, meaning a more basic environment to release. Well, if they're taking an acid-lowering medicine, then their stomach is a more basic environment, and it can release right away. So there are a couple of factors we know about now, but essentially, Vyvanse takes the absorption, the stomach absorption out of the equation. So if you or your loved one or somebody you work with, if Concerta only lasted 8 hours instead of the 12 it's supposed to, or if Adderall only worked 6 or 8 hours instead of the 12 it's supposed to, consider Vyvanse because it works in a different way. Now let's talk about the non-stimulant approved, the only one we've got officially approved in Canada for ADHD, called Strattera. The other name for it is atomoxetine. It's a norepinephrine reuptake inhibitor. It doesn't work right away. It takes at least 3 to 4 weeks to start working, and generally I like to give at least 6 or 8 before completely writing it off. So you need to give it some time. Now there are some people who respond in a week or 2 or 3, which is fantastic, though I need to educate people that they need to wait in case it doesn't do anything. Recently I had a daughter of a pediatrician, a woman who I know, and she asked me to see her daughter. I thought Strattera would be the best medicine for her based on her symptom and presentation. We started it. I happened to see them 3.5 weeks after she started it, and it wasn't doing anything. And then I felt bad because this is a colleague. I really wanted to help her out, and and then I said, well, maybe we should switch over to the stimulant. She said, well, March break is just coming up. Maybe maybe we should give it the full 4 to 6 weeks that you said, and all of this stuff. So we did, and when she came back after March break, at about 4 to 4.5 weeks, the medicine kicked in. And all of a sudden it was working. So you do need to give it a bit more time. And it has to be taken 7 days per week. We already spoke about the fact that we don't aim for medication holidays, though when it comes down to it, sometimes people do stop medicine or forget medicine. Strattera has to be 7 days a week. It's a non-stimulant. This can play a role of biases about stimulants. People may come in and say, I don't want any of those stimulants. I will tell you, I will never just give them Strattera and feed into their bias. I got to educate them first, because if Strattera doesn't work, we're all here to educate more people about ADHD. I got to make sure to address their misconception. Generally, it's once a day dosing. Occasionally, people will need twice a day to get the full 24 hours of benefit. It's rare to have personality changes with Strattera. No abuse potential at all. They've done likability studies. If anybody tries to snort Strattera, they're going to burn out their nose. It's going to be terrible. It does not produce a high. It's not likable. People don't use it in that way. It's not a controlled substance, so compared to the other medications,